So now we're leading into the main event. I always do a drum roll. Dr. Sara Jackson is the medical director of the adult medicine clinic at Harborview Medical Center in Seattle, Washington. She's an associate professor at the University of Washington Medical School, is a board certified in internal medicine and addiction medicine, and has been engaged in patient care and research related to OpenNotes in a safety net setting for the last 10 years. We're excited to learn from her today. Dr. Jackson, please take it away.
So next slide. I have been working with the OpenNotes group and on OpenNotes incredibly for I think over a decade now. And I work at Harborview Medical Center in Seattle, Washington. Harborview is a level 1 trauma and burn center, but it's also the primary care location for the safety net population of King County. And my clinic, the adult medicine clinic, is in one of those windows there. And we're a large teaching clinic. We have about 36 continuity internal medicine residents who have their clinics there. Medical students rotate through it. There's also at Harborview an HIV clinic, a clinic for non-English speaking patients, and another clinic for homeless patients. And when the OpenNotes original study first rolled out, I remember being at the clinic meeting where we discussed the concept. And I will say that there was a lot of very healthy skepticism about, honestly, some just thoughts that this was a really dumb idea, and that notes were for doctors and for doctors' communications to other doctors, and this would create all kinds of problems. So we, before the pilot began, and I should add, our patient population is, we see patients with complicated mental and social conditions. We have a lot of patients with mental health and addiction issues, homeless, non-English speaking patients. And so we did some focus groups prior to the original study in the adult medicine clinic and also in the HIV clinic at Harborview. And just to sort of summarize their thoughts, the patients were able to imagine perceived benefits primarily in that they would understand their health care better. It would be more convenient for them to be able to see the information, that it would be empowering for them, and that it would improve their relationship with their provider. Their concerns were about privacy and people hacking into the computers. And then they were worried about whether they would be able to understand it all. They worried that the computer would replace their ability to actually reach their doctor, and they really valued that ability to connect with their own doc. And then very kindly, they were concerned that it would be a burden for their doctors. Kate's already kind of summarized the results of the larger study between the 3 sites, but I'm going to focus a little bit specifically on Harborview because the subgroup data from Harborview, because it is a safety net population and a little different from the larger group. But I think one of the big take-home messages is that patients in the safety net, just like at the other sites, after having had access to their notes, very similarly felt that they had more control, they understood their conditions better, they were better at taking their medications. So more similarities there. And then the things that we really worried about, that would be confusing, that they would be worried more. This was slightly higher than the other sites, but still really relatively small, 8% for those. And then I think the doctors also worried about patients being offended by things that they had written. And really a very small proportion of folks at Harborview felt like they had been offended by what they read. And then I think a very interesting piece is that in our safety net setting, it was over double compared to the other sites, the percentage, 42% compared to 20% that had shared their notes with either a family member, a caregiver, another professional. So they were interested enough to share that with others. And similar to the other groups, they thought it was an important factor for choosing a future doctor or health plan. And then the providers, who had been very concerned about what this would look like afterwards, after the study, really, they didn't, the visits didn't take longer. They didn't really spend more time on their notes. A fraction were less candid in their documentation, but generally everyone, patients and providers, wanted to continue the patients having access to their notes. And then just a subset, because we did do this originally with patients who had HIV, because this is a sensitive topic, we looked at how these patients compare to patients that didn't have HIV, and basically it was the same as far as their perceptions of risks and benefits. And they also were more likely to share their notes with friends, health professionals, other doctors. It was like 38% shared with another doctor. And you can imagine patients coming from all over Washington for their HIV care and being able to share that information with their local providers would have been helpful for them. And then the HIV doctors, and there were a lot of them, were less likely than other doctors in other settings to change the level of candor in their notes. So that was good feedback. And then, so 2014, about 4 years after the study, UW, the whole system-wide, open notes to patients. Anyone who had an eCare portal access would be able to link and read their doctor's notes. And the process for that really was, of course, there's email, and then clinical leaders would meet at section meetings, department meetings, clinic meetings, sort of letting everyone know that this was happening. When we did it, we did not actively message this or market it per se to patients. I think that was because that there were doctors who were worried, if what's going to happen, when this goes live. And part of the information that was shared in those meetings, we had FAQs for patients and providers that were circulated. And then we talked about tips for providers about how to write shared notes, because this is a new skill. We learn in medical school how to do shorthand and all of these pieces, but how do you write it for patients who are going to read your note? And this is in this article by Klein et al. And I'll just briefly kind of hit some of the highlights for those, since this is a 101 session. Before a visit, we recommended that docs develop a clear template. We use Epic, so a template that is easy to navigate. I think is helpful for not only patients but other doctors and yourselves, and not one that's filled with a lot of added in information or note bloat. And then for patients that you really are trying to engage through the note, who you think this would really help to have afterwards, or in their care partners, letting them know that they'll be able to read them and why it might be helpful, that they can look afterwards and see what you all had talked about. And then this part about consider writing notes with patients. There's a lot of work that's going on with that. The Our Notes work that I won't go into in detail, but having patients be able to put information in from the portal about their interval history. And then this is just on a simpler scale, will often, as a patient is telling me a lot of stuff, I'll say, because I type notes, I'll say, well, let me make sure I'm getting this right. And I'll actually type it and say the words that I'm sort of summarizing as I put it into the note. And it that can help them to realize that information is going in and in what form. And so during a visit, I think it's helpful to just think of it as a communication tool, not so that it becomes this complicated process, but just it's an opportunity to really share this information in a clear way. Sometimes I know in visits, things can go pretty tangentially, and when I write the note, I kind of make it clearer for myself. And this, I think that can be helpful for the patient also. And I think people worry a lot about sensitive issues like, could this be cancer? Are they going to talk about my cocaine use, obesity? And obesity, I'll just mention, is sort of a hot button phrase that I think patients do often. They don't feel good about seeing. But I think these are things that really do they're thinking about, and being clear about it in the note, and connecting the pieces so that they understand what you're thinking, I think is important. And then this is something that I think, I think most docs do a lot verbally, really being cheerleaders for patients is something that you do during the visit. But you can also, I do think this is something that I have changed since OpenNotes is really putting that in there. It has done a great job despite all of these barriers to, with X, Y, and Z. And that placebo effect, I think, can be beneficial. Also during a visit, being objective and not judgmental. We definitely get, in having been involved in these focus groups, very specific comments about things that doctors have written about their about patients or loved ones that they have taken offense to. And these are a couple of examples there. And often they're words that we've learned in a non-pejorative sense, like refused as opposed to declined. But there are subtle aspects to that make the patient seem like they're that have connotations. And I'll just share my example of that. My husband went to see a dermatologist and got his OpenNote back, and in the physical exam, it described him as a middle-aged, semi-athletic male. And this was a visit for his rosacea. So it was pretty devastating to just see that, and whether that's accurate or not is a question. But whether disease does it really need to be in the note is something to think about. And then of course jargon and abbreviations. And I will just say, number one, patients realize that the notes are for doctors. They totally understand if the language is going to be above, about 8th grade reading level. So it's fine to put those things in there, especially if it makes your note writing easier. But if you have a way to not use abbreviations, I think that also can help across specialties. And as I get older in the practice of medicine, they change these abbreviations. And so I think it can help even with provider communication to avoid using those. And of course, the classic one is SOB, shortness of breath. Sometimes for patients that can be off-putting. And then after a visit, of course, there are lots of reasons to have your notes done in a timely manner. And then I think, you can use it as a tool. When the patient comes back, you pull up your last note and say, did you get a chance to look at this? How did it go with X, Y, and Z? And then you can get feedback about what they thought about the note. And then amendments. I'll just throw in here that over the last decade, I've had, I think, 2 patients request amendments. One is a patient who avidly reads her notes and sends a lot of e-care messages. And I had misrepresented a piece of her social history, which made 0 difference. And so I went back and I changed that. And then the other time there was a gentleman who asked me to change something that I really thought would be inaccurate. And we discussed it, and I did put in an amendment which just said, so-and-so feels that this is, not correct, but because of X, Y, and Z, this is what I'm putting in here. So I think you have to be honest in that process. When there are things that are inaccurate, it's super helpful to have patients who catch it and you can change for future users of the notes. And so we were also interested, so after the entire system went live, we went back to our vulnerable clinics, our adult medicine clinic, Madison clinic, and we did more focus groups. And before we did this one, these were people who had access. Before the original focus groups, it was sort of this hypothetical thought exercise. This was after they'd had access to OpenNotes for years. And because it was the pilot and after the system went live. And right before the focus group, we had them read their last primary care note. And then, so we captured a little quantitative data and then did the focus groups. And they thought 89% found that the note content was helpful. Similar to the other studies that Kate mentioned, about 20% found some inaccuracies. And about a quarter felt that there was too much medical jargon and that it was too long. But as far as the focus group themes, they also appreciated having that more detail. That was one of the themes. They would rather have more detail than less. Another theme was if the content was confusing, they would rely on the provider to explain that confusing content. And that sort of circles back to that confusion and worry. When people feel that when they read their notes, they can always go back to their provider and get more information. And then the inaccuracy pieces, they particularly found those in the heavily templated notes, which we definitely had. I think we're sometimes at the mercy of our vendor sometimes with our note templates. Yeah, and a couple of quotes. Oh yeah, give me all the information because I'm going to look it up otherwise. So at least here it is. This is more bulk, more data. I think it's good. And then this one about families. This is good information to have, and it would be good for my kids to know and have. I don't have to explain every detail to them. They would just know what is what and how to go about it and take care of it. And I think this piece about being able to share with loved ones is really a key component of OpenNotes. Next slide. And I'll just make a few comments about COVID. So 9 months of COVID pandemic. Our institution, just like everyone, has really had a huge push to try to leverage as much telehealth as possible. And I'm just showing here that for Harborview, which of course is our safety net population, the percentage of folks a year ago who had their portals active compared to this year, it's still less than half, but there has been a large increase. When COVID occurred in the spring, we had a lot of medical students who couldn't see patients, and so they came up with a pilot project to reach out to our patients who we were trying to reach by phone and try to get them set up for Zoom, the audio-visual visits. And as they were doing that, they were kind of collecting data on what some of the barriers were for our safety net folks. And what they found was that about a quarter of patients just did not have the technology or the Wi-Fi access or enough data on their phones to really be able to engage this way. And for folks that were 50 and older, it was about half of patients that just weren't able to do this. And so I think that this is just, with COVID and technology, this is going to be an important thing for us to work on to decrease the inequity of care that we're able to provide. And it may mean human beings actually helping in addition to the tech component. One other piece about COVID that I'll just mention, we're all, as doctors, we think about OpenNotes from the perspective of the note writer, but we're also all patients. I'm a patient in this system, and I can read my notes, and so that's been beneficial. But also, particularly during this COVID pandemic, I have my parents, I'm in Seattle, my parents are in Kentucky, and they both now have COVID. And luckily, they've been at home so far. But if they were to go into the hospital in Kentucky, it would be so amazing if I was able to connect via a proxy server and see what was going on and be able to relay that to my siblings. And so there are benefits for docs across multiple. We're also patients and caregivers. Okay, so just to summarize, after a decade of using OpenNotes at Harborview, it has really not been a burden at all for physicians. I don't think about it. I've made some subtle changes to my notes, but it did not break anything. I do think it's been, for patients who have been able to engage and use it, the feedback has been really positive. I think it's the fact that their doctors trust them enough to let them read their notes and engage with them about their notes is really huge. The relationship building and just having access to their own health information is very valuable to them. And there have been UW-wide increased note amendment requests, and I think particularly in the case of inaccuracies in the records, having someone who is an avid reader and deeply invested in making sure that things are accurate, this is a really big positive of OpenNotes. And then I think looking forward, particularly in the time of COVID, being able to support patients in instruction and utilization of these electronic tools is really important, particularly in safety net populations. Thanks.
Thank you. Thank you, Dr. Jackson. That was incredible. I'm sure everyone who's tuning in is really appreciating the stuff that you have to share